One or a friend has ever gone through chemotherapy, you know the treatment is hard but essential. It's absolutely necessary. So imagine doctors, including here in Western New York, having to essentially decide which patients will get the treatment first and which might have to wait a bit. That's because there is this national shortage in some cancer drugs. Many clinics and cancer centers, including Roswell Park in Buffalo, only have 1 or 2 weeks worth of supplies of drugs like cisplatin and carboplatin. Local Congressman Higgins has now signed a bipartisan letter urging the FDA to address these shortages and supply chain issues.
To find a way to do more domestic manufacturing so that we don't run into these problems and thus these delays. People who could otherwise be cured are not getting the life-saving treatments that they deserve, that are so essential to their survival. This is an emergency situation.
Higgins said while the issue has been going on for a while, it's really picked up of late, but dates back to about the beginning of this year. Joining us live now to help provide some insight on this is Dr. William Dayhead. He is the Chief Scientific Officer with the American Cancer Society. Sir, it's really great to have you on the show tonight. I know this headline has been startling to a bunch of people, and so I wonder if you can help explain how widespread this shortage is right now and what types of cancers are impacted.
I think it's a real problem, and I'm really glad you're highlighting it, and the comments made by the congressman I can certainly completely concur with. The concerns are that these drugs are drugs used up front in cancers such as breast cancer, head and neck cancer, bladder cancer, testicular cancer, and lung cancer, in which we're trying to cure a patient. And we're thinking it's perhaps almost 20% of cancer patients actually would be receiving drugs like this. So it's really a major problem.
Doctor, we heard the congressman there bring up the issue that the U.S. needs to manufacture more of these drugs here. How does your organization support this effort or at least follow this effort? And what can you tell us about, maybe kind of the efforts to change some of those supply chains?
So I think the issue is that a lot of these drugs are generic drugs. They're drugs that are still very effective, but they've been off patent for a long period of time. And because of that, there's really not a lot of incentive for manufacturers to put money into redundancy and keep the plants up. And many of the manufacturing of drugs such as these are not done in this country, done off-site. And if you run into a problem, whether it's a poor inspection or whether there's a manufacturing fault, there's really not the ability for capacity to build things up. So we need a safety net, whether that's drugs produced in this country or a supply somewhere, but some way when you run into an issue that there's redundancy, because these are really life-saving treatments.
Yeah, no doubt about that. I want to play for you a little bit more of what the congressman said, talking about the funding for all of this. I'll get your reaction after we listen.
But the United States spends so much money in drug development that we are experiencing this is inexcusable. We need to take decisive action.
Doctor, I think you might agree there. We spend all of this money, and then to deal with this shortage, just ballpark, if you had to guess, how much money are we talking about is put into cancer drug development? And obviously, it's not a penny too much, right? I mean, we need that funding.
No, there are billions spent on cancer drug development, and what will be noted is that shortages do not tend to occur on newer drugs that are drugs still on patent. And these are the drugs we talk about where prices are the highest. But these other drugs, there's really very little profit for the manufacturers. And so some way to sort of have a balance here where drugs that are still effective are not very expensive, that there's still a motivation for people to make them in quantities in which we can keep patients safe.
And Dr. Dayhead, I wanted to ask you about sort of the personal side of this. Anyone going through chemotherapy, your hearts are with them, especially if they're having to deal with something like this. You also think about the doctors. I mean, do you know of situations in which, because of the shortage, an oncologist may have to say to a patient, you might have to wait a little bit longer or maybe prioritize some patients? And I imagine that's just gut-wrenching for a physician.
No, it's a horrible situation. Sometimes these drugs are used in a more palliative setting in which there are other alternatives that can be used. But for patients that can be cured with these drugs and to have the possibility that they're not available, I think is a horrible situation for the patients, the families, and the community they're around. So we've heard a lot from the gynecologic oncologists, because they treat a lot of these tumors affect women, the breast cancer, ovarian cancer, and others, and there's dramatic shortages across the country. So it's a very, very treacherous situation.
Yeah, and something that we will continue to follow and hope it gets better sooner rather than later. Dr. William Dayhead is the Chief Scientific Officer with the American Cancer Society. You're a busy man, sir. You're kind to take some time for us.
Yeah. Thanks so much for having me on today.
You bet.